leadership vacuum of the lame duck period comes as the coronavirus pandemic is shattering records, with more than 176,000 new cases on Friday. Cases are up over the...
So here we are, November 15th, 2020. And here we are repeating what we went through at the beginning of this year with the whole coronavirus hysteria, so-called pandemic. Let's get into it right away.
Past 2 weeks in 49 states and D.C., more than 69,000 people are hospitalized and deaths have risen in 31 states.
This surge is much more
Don't let them fool you. We already know the data is completely skewed. We know how they count COVID deaths. It's not based in reality. All right, it's a lot of number games here, so let's continue.
It's widespread and dangerous.
It is spreading rapidly everywhere.
Fear propaganda.
We're heading towards the cliff. I don't know if the vaccine gets to us before we have horrible things happening here in Wisconsin.
All right, there's another thing. They're building a fear to try and entice people that vaccines are their only savior. If you've done any research on vaccines and you understand how they fast rolled this and what the ingredients in vaccines are, then you'll have the intelligence to know that running to get a vaccine can be detrimental to your health and the health of your family.
Issuing new restrictions, including a mask mandate in North Dakota, and on Friday, Wyoming's governor said he is considering one as well.
We haven't got our head in the game. We're running around like chickens with their heads cut off. Let's get serious.
As the coronavirus continues to spread.
I am announcing a 2-week freeze for the entire state.
Total lockdown.
And what happened last time? Started as a 2-week thing, right? And how long did this continue? And it's still continuing. Okay, maybe we're not still all being told to stay in our homes. But when has any cities or states really lifted any mask mandates? No, they're all still in place. How many times did they continue to extend the lockdown and the stay-at-home orders? You know, you can't trust these people. Ain't no temporary thing with them.
Don't start to get more serious and follow the rules.
You know what's really
ain't nobody following.
And as you can see by this chart, the number of new cases has skyrocketed, more than doubling in recent weeks. One person has been predicting this kind of turn in the pandemic since he first appeared to meet the press back on April 26th. Dr. Michael Osterholm said then we were in the foothills of this crisis and had mountains yet to climb. And if you could see that daily case count since the start of the pandemic, it looks like an ever-growing mountain. Dr. Osterholm is, of course, an infectious disease expert at the University of Minnesota, and he's now a member of President-elect Biden's COVID Advisory Board. Dr. Osterholm, welcome back to Meet the Press. I thought it was important to get your perspective first before I got to President-elect Biden's Chief of Staff, Ron Klain. So let me just simply ask you this. We're seeing the exponential rise that you sadly predicted would happen in COVID cases, you and many others this fall
it wasn't
winter.
A prediction, okay? These were plans. You can look back to Event 201. These were plans. World Economic Forum, John Hopkins, Bill and Melinda Gates Foundation. It's not predictions.
Here we are. Are we going to plateau anytime soon, or is this trajectory just going to keep going up and up?
Well, thank you again. And let me just say at the outset that our future is in our hands. And right now, for at least the next 3 weeks, because cases are already in the pipeline, meaning they're already infected, these numbers are going to go way up. Our job is to imagine what the world could be like if we do make the changes we need to make. We're going to be heading to a vaccine in the next few months where we could start to imagine having summer baseball back, barbecues, etc. But in the meantime, we are in a very dangerous period, the most dangerous public health period since 1918. And if we don't basically take important steps like stop swapping air with our neighbors, our friends, our colleagues, we're going to see these numbers grow substantially.
So what should happen
share air with your neighbors, your family, your friends? Why are they ramping this up so heavily right now? Because how many people come together during the holidays? Okay, the agenda, part of the agenda is they don't want people congregating together, especially families. Because what happens? They begin to speak and share ideas.
Now, I mean, I've talked to plenty of mayors this week and governors this week, and they all feel like that. You can tell they all want to do more, and they're hesitant because of the fatigue, because of the economic impact, because of the lack of leadership from the federal government, perhaps the lack of money from the federal government. This is the situation we are in. not the utopia that we'd all like to have in governments working together. What do we do right now? What does a local mayor do without the help of the federal government?
Well, it's critical that we do get the help of the federal government, and I can't make that any more straightforward
means control.
than that.
That's what y'all want.
If we're going to control this virus out in our communities right now, we're going to have to support those who are going to be suffering economically. You know, you have a choice. Do you want to have schools open, or do you want to keep bars and restaurants open?
How many people have lost
Well, if you
their
shut
jobs
down
and you
bars
get
and restaurants, they're hanging on by a thread. That
stimulus.
single mother
Get outta
waitress
here.
that basically doesn't have any other income. We have got to support them in helping to do the right thing. They want to.
No,
I don't know
y'all ain't
anybody
doing
that doesn't
nothing right.
want to. If we're going to help our healthcare system right now, try to respond to this crisis, and we know that they are at a tipping point, we have got to have help right now. And so I just urge that the last thing we do is support our governors. They are the front lines right now. There is no national leadership on this issue. They're trying. I don't care if they're Democrat or Republican, they're trying, and we've got to support them in these issues.
Look, now that you are a member of President-elect Biden's COVID advisory
stay out
board,
of our lives. That's what we
any
need.
comments you make are suddenly going to get put through a different prism. So I want to give you a chance to clarify what you meant by the 4 to 6 week lockdown, because you said even back in August, look, we got to have some pause here and have some sheltering in place if we have any chance at bending this curve.
Well, first of all, we've got to reframe this issue. We have got to understand again that what we're trying to do is get to this summer when we have vaccines that can fundamentally change how safe it is to be in everyday life. And what we need to do right now is...
So the end goal is for you to get a vaccine if you want to return back to normalcy, to any way of going back into society and existing in a way where you're treated like a human being, whatever that means in this day's age. You're gonna be pressed to get a vaccine. They're probably gonna have all kind of vaccine, basically cards or vaccine certificate to prove you've been vaccinated, or else you won't get access to many services. That's just how they're going to do it.
What's going to make that difference. And as I just said, it's very important that, first of all, we don't swap air with people. That's how this is being transmitted. And we have got to do whatever it takes to support that. You see the governor struggling right now. They want help. I've actually talked to 5 governors in the last 2 days. All of them said, wouldn't it be wonderful if we could all at least be on the same page? But right now, you've got my state's surrounded by 4 other states, and they all have different recommendations. That by itself is what we're talking about, standardizing how we're all going to approach this. This virus doesn't care what party you are, doesn't care where you live. We have to understand that that's what we have to work on right now.
Dr. Ostrom, it certainly looks like the case count's only going to go up. The hospitalizations are only going to go up, and the death count is only going to go up between now and the beginning of
that's what y'all want. That's what
passing out this vaccine.
That's just how it is.
How close to the breaking point is our hospital system, and at what point is that going to be the point where
last time
the hospital system's going to force us to shut down? We all will have no choice.
We found out nobody was going in.
Well, I think you said it very well. You know, my worst fear is what we saw happen in other countries where people were dying on the streets. People literally were dying in the waiting room of emergency rooms after spending 10 hours just waiting to be seen. That's going to start happening. The media will start reporting it, and we will see the breadth and the depth of this tragedy. That, I hope, will not be the way that we finally decide to reduce our risks, this idea of swapping air. We got to stop doing that. And so I think it is the healthcare system's breaking, literally breaking, that will unfortunately bring us to a sense of reality of what we must do in the short term.
And how close are we to that point?
Well, you know, the case numbers, as you've seen how quickly they've been rising, I think that's going to continue. And there are many healthcare systems that a few more weeks of this level of activity, and that will happen. That will happen.
Well, there you go.
Dr. Michael Osterholm of the University of Minnesota.
If that's correct, then early December we'll see them saying that the hospitals and the medical centers are at their breaking points. They're overflow. They can't take care of everybody. People are dying out in the streets, as he put it. That's what you're going to see. That's the fear. These are their plans. They're letting you know. They're prepping you that this is what they're going to do.
Soda, we have you on here to give us the straight talk, and you always do. I appreciate you coming on and sharing your perspective with us and your expertise. So joining me now is the President-elect Joe Biden's choice for Chief of Staff. It's Ron Klain. Mr. Klain, welcome to Meet the Press.
Thanks for having me, Chuck.
The models indicate that another 100,000 Americans may die before January 20th. We may be sitting at a case counts well over 200,000 by the time you take over in this administration. So what do you do now in anticipation for what looks like is going to be exponentially worse in 60 days?
Yeah, Chuck, I mean, it's a very grave situation. Back in September, then candidate Joe Biden warned that America was headed to a very dark winter if the administration didn't step up its action. And, the very first business day of his transition on Monday of this week, the president-elect met with his COVID task force and then made a public statement afterwards where he called on all Americans to mask up. He urged governors to impose masking mandates now and reiterated the fact that when he becomes president...
Everywhere I go, I see people wearing masks. I don't even agree with it. And I see everybody wearing masks. And the numbers are still spiking like this, as y'all put it. So the masks aren't helping. I guarantee that.
He will impose one on a nationwide basis. And so, look, he's not the president now. There's not that much that Joe Biden can do right now to change things other than to reiterate kind of the message you heard from Dr. Osterholm, which is that all Americans and our state and local governments need to step up right now. If the president, the administration is not going to lead, that's where the leadership has to come from. That will change on January 20th. But right now we have a crisis. It's getting worse.
There's another part of the plan. January 20th, when they put Biden in the office, they're going to come down with some heavy restrictions, federal restrictions on behavior and, how you're allowed to move in society. They're telling you this all right now.
We had never had a day with 100,000 cases in a single day until last week. By next week, we may see 200,000 cases in a single day. So this is getting much worse, Chuck.
What do you, I'm curious, with your coronavirus advisory board, has there been any even informal contact between the task force and your advisory board? Has there been informal contact for instance, between the president-elect and Dr. Fauci?
Unfortunately, Chuck, we can't. We can't until we get that GSA ascertainment that authorizes us to contact government officials. And so we can't have any of those kinds of contacts until we get to that stage of ascertainment. Obviously, there's information that passes in scientific circles. The people on our task force, like Dr. Osterholm, are leading scientists. But Chuck, I think you hit a key point, which is that Joe Biden's going to become president of the United States in the midst of an ongoing crisis. That has to be a seamless transition. We now have the possibility, we need to see if it gets approved, of a vaccine starting perhaps in December, January. There are people at HHS making plans to implement that vaccine. Our experts need to talk to those people as soon as possible so nothing drops in this change of power we're going to have on January 20th.
Have your folks been able to have any contact with Pfizer at all? And do you have a better understanding of just how soon the vaccine could get distributed?
We're going to have meetings between our top scientific advisors and the officials of these drug companies, not just Pfizer, but there are other promising vaccines as well. We're going to start those consultations this week. But again, I think that there are two issues here, Chuck. One is the scientific issue around the vaccine. But I think in some ways the bigger issue, I've been saying this since April, the bigger issue will be the mechanics of manufacture and distribution and getting this vaccine out. And that really lies with folks at the Health and Human Services Department. We need to be talking to them as quickly as possible. You know, it's great to have a vaccine, but vaccines don't save lives. Vaccinations save lives. And that means you got to get that vaccine into people's arms all over this country. It's a giant logistical project.
Yeah, you have said, and in convincing the American public in a previous interview, you said in 2021, convincing them to take the vaccine might actually be the biggest challenge we face as a country. But I want to stick with one more issue on the current COVID crisis.
So there you go. I mean, they're putting the plans right out there in the open, right? They're going to ramp up the numbers. They're going to ramp up the hysteria, the cases, the reports of deaths. You know how to mess with the numbers on that. They're going to ramp all that up to build the fear. Then they're going to come with, it has to be a federal response, or it's just going to be as it was before, with a bunch of the states, the governors are going to implement stricter restrictions than even earlier this year. And then, the next thing after that, they're going to start implementing vaccinations. And it basically, if you don't take them, you're not going to have access to society. And you know what? I don't care. I won't take one. I won't take one. I suggest you don't, and don't give it to your children. It's dangerous. And look, we're all still here alive. Don't let people put you in fear and control you.
Which is, you've heard Dr. Ostrom, every expert has said, if we might have to have a temporary shutdown, but we can't do it if you're not going to basically pay these people not to open their businesses. Can't do that without Congress agreeing to something. How urgently do you think House Democrats, Senate Republicans, they're loggerheads? Do you take what you can get now, or do you support Speaker Pelosi holding out?
Well, the president-elect had a conversation with Speaker Pelosi and Leader Schumer on Friday, and they talked about the need to get urgent action. I mean, we need action during the lame duck. There's a lot of things that are going to have to wait until Joe Biden is president, but this is not one of them. Getting help to people, we need urgent help to individuals, but we're going to see layoffs of police, of firefighters, of teachers in the next month in a lot of states and localities unless these local governments get the aid they need. I know that Speaker Pelosi is committed to that. I know Leader Schumer is committed to that. This shouldn't be partisan. By the way, these layoffs are coming not just in so-called blue states, but red states also. This is a national crisis. It needs bipartisan national action now.
Has the president-elect spoken with Senate Republican leader Mitch McConnell yet about this issue?
So there you go. There's going to be a lot more job loss. There's going to be a lot more people struggling, foreclosures. People going to get kicked out of their homes, not being able to pay rent, not being able to feed themselves or their children. All for the name of control, for mass vaccinations, for controlling how you can behave as a grown adult. If this is what you guys want, go for it. This is not what I want. My life will not go this way. I will completely rebel against it. And I hope you guys do too. Talk to y'all next time. Take it easy.